morning, everyone. Public health news is back with me, Nabila Arifadah. Heart attack occur regardless of age. Current studies have found that young age does not necessarily make a person immune to heart disease. This is an alarm for those in their 20s, 30s, or 40s who still ignore the importance of maintaining a healthy heart. How to maintain heart health and avoid heart attack from a young age? Already with me through the Zoom connection, there is a heart and blood vessel specialist at the Siloam Hospital Surabaya, Dr. Amelia Puspa, SDJP. Hello, Doc, and how are you? Hello, good morning, Alhamdulillah, I'm okay. Okay, doctor, let me start the conversation first. Heart attacks must be considered because cardiovascular disease is the main non-communicable disease that causes human death in the world. Recently, many cases of heart attacks have occurred in young artists such as Asghar Sinclair, Melissa Sidabutar, and Mike Mohede. So, is it true that a heart attack can occur at a young age, doctor? Heart attack is an emergency condition that occurs when the blood supply to the heart is completely blocked, so the heart muscle cells are damaged. Heart attacks are usually caused by coronary heart disease. If not treated immediately, a heart attack can cause permanent damage to this organ. Heart attacks generally occurs in adults. However, it is possible that even young people can have a heart attack. Currently, cases of heart attacks at a young age are increasing. Based on the Riset Kesehatan Dasar Kementerian Kesehatan in 2013, in Indonesia, heart attack reached 12.1% of the population. This disease is increasingly affecting the young age group, namely 39% aged less than 44 years. As many as 22% of young heart patients are in the range of 15 until 35 years. And the next question is, what are the causes of heart attacks, especially those that occur at a young age? The United States Center for Disease Control and Prevention, or CDC, refers diabetes as a key risk factor for heart attacks in a young people. If you have diabetes, you are 2 to 4 times more likely to die from heart disease than people who don't have diabetes. Because the problems that arise due to diabetes are diverse, diabetes occurs when the blood sugar level in the body is too high. High blood sugar levels can damage blood vessels and increase the change for fat and other substances to accumulate in them. In the end, blood vessels, aka arteries, are blocked or hard and narrowed so that the blood supply to the heart is disrupted. Other contributing factors include 1. Hypertension or high blood pressure, 2. Obesity or overweight, 3. Cigarette, 4. Use of illegal drugs and alcohol. Especially for a woman under the age of 50 years, there is a cause of heart attack called continuous coronary artery dissection, or SCID. SCID is a medical condition characterized by continuous tearing of the inner lining of an artery. Generally, the tear will heal on its own, but if the tear persists and is not treated at the heart hospital, the patient's life can be threatened. The heart can be damaged and eventually lead to death. Thank you for the explanation. And then, what are the symptoms to watch out for from a heart attack, Doc? The most common symptoms that can be encountered if you suspect that it is a heart attack are 1. Chest pain is usually in the middle, slightly to the left because the heart is on the left chest. 2. Discomfort in the chest, then spreads to the back, neck, hands, accompanied by cold sweat and shortness of breath. 3. Chest palpitation and back pain are also symptoms of a heart attack. What to do if we experience these symptoms? Individuals who experience these symptoms for the first time should check with a cardiologist for examination that can confirm whether these symptoms are indeed related to a heart condition or not. Cannot be treated alone because the symptoms can be similar to other disease. Okay, doctor, and the last question is, what are the preventive steps that young people can take to avoid having a heart attack? How to prevent heart attack? 1. Choose healthy food. Avoid food that can reduce the risk of heart disease, such as food low in saturated fat, trans fat, and sodium. Expand high fiber foods, such as fruits, whole grains, nuts, and vegetables. Choose low-fat dairy products and low-fat meats. Limit sugary, high sugar foods, as well as red meat, quail, eggs, seafood, and other high cholesterol food. 2. Physical activity. One way to prevent heart disease that a person can do at a young or old age is to do regular exercise. We can do regular exercise such as aerobic every week or light exercise such as leisurely walking. The more physical activity you do, the healthier your health will be. 3. Manage stress and get enough sleep. It is better to manage the stress and sleep properly. High stress level can cause a person to have an unhealthy diet and lifestyle. Finally, this condition can increase the risk of heart disease. And the last step is stop smoking, avoid cigarette smoke, and excess alcohol. If you have a habit of smoking and drinking excessive alcohol at a young age, immediately avoid this habit. Smoking habits can increase the risk of heart disease. This is because some of the content in cigarettes, such as tar, carbon monoxide, and nicotine, can cause heart problems. Wow, our conversation today with Dr. Amelia is very interesting, but that our time is up. Thank you, Doctor, and maybe we will talk again on another occasion. And this is the information we can convey about maintaining heart health and avoid heart attack from a young age. Please take care of your health, and thank you, Doctor. See you next time, everyone.